Good afternoon. My name is Raffle France. Can you say your name for the record, please?
Good afternoon, Raffle. My name is Rachel Water.
And what's your candidate number, please?
My candidate number is 23000246444.
Thank you. And you are taking this test as a doctor, is that correct?
Correct.
Thank you. Can I see your ID, please?
Sure.
The warm-up questions are not assessed as a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
Okay.
What steps do you take to prevent medical malpractice?
I take my job very seriously, and so I do my best to get a broad understanding of the symptoms through communication with my patients, examinations, and further testing. I feel that it is also helpful to consult with other physicians in cases where I am not certain of treatment, and I am careful to refer patients to specialists for matters outside of the typical scope of my practice.
How do you remain current in your medical training?
To remain up to date on the relevant research in my field, I attend yearly conferences in internal medicine, and I maintain subscriptions to receive news about the internist community, and information about clinical issues in internal medicine. I make sure to follow the latest studies that affect internal medicine, as well.
How do you interact positively with support staff?
I understand that the support staff, such as nurses, CNAs and administrative professionals, provide essential care to patients and deserve to be treated with my respect as members of the health team. I make sure to get to know the individuals on the support team so that I can encourage them to provide the best care possible, and also to pay attention to their expertise and the information they get from their interactions with patients.
How would you deal with a rude doctor?
I have been very lucky in that. I have had the good fortune to work with doctors who were always professional in their interactions with me. If I were to work with a doctor who treats me badly, I would bring the matter to my supervisor right away. That's because, if the doctor was displeased with me in some way, I would want to find out so that I could take action to rectify the situation.
Why do you want to become a doctor?
I want to become a doctor for 5 main reasons. The first reason is, I genuinely care about people and I want to be a part of a medical team that provides the highest levels of care achievable. Secondly, I enjoy working under pressure and will feel a great level of professional achievement when I am working under strict time constraints. The third reason is, I want to be in a position where I can influence people to make better and more informed decisions about their health and well-being. The fourth reason is, I want to work as part of a wider team, who are all working towards continually improving and developing the care we are all providing. Finally, from a personal perspective, the position of a doctor is secure and, providing I performing my duties to the highest standards possible.
Great. Thank you very much for sharing that. So, let's move on to the role plays now. I'll take the part of the patients, or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when 3 minutes are up. You can ask me if there's anything you are not sure about, and you can make notes on the role play card if you want to. Here's a pencil for making notes.
Thank you.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. The role play will now last for about 5 minutes. Don't worry if I stop you when the time is up. Can you start the role play, please?
Good morning. Myself Rachel, I am the doctor on duty for today. How may I address you?
Hi, I am Peter Campbell.
Hi Peter, may I know what brings you here today?
Doctor, I'm a bit worried about my situation. For the past 5 days, I have been experiencing a cough, runny nose, and sore throat, and later on, I developed a fever. chills and muscle ache. Therefore, I kept myself isolated from others. Unfortunately, from today morning, I also started with nausea, vomiting as well as breathing difficulty.
Oh, is it? If you don't mind, shall I ask you a few personal questions?
Yes, you may proceed.
In this setting of COVID-19 pandemic, may I ask you about any sort of contact with COVID-19 patients, or any history of travel in the recent past?
Yes, before 14 days, I have traveled to a country that reported a higher number of COVID-19 cases, and I do worry that I am affected by the virus.
All right, I appreciate you for the timely management. After listening to your symptoms and recent travel history, there are chances for you to have COVID-19. For confirmation, we need to do some investigations. Is that okay with you?
May I know, what are the investigations you suggest?
For better identification of the cause of your illness, we must go for a nasal swab and throat swab. It is a small procedure that will only take a few minutes. It is to identify the type of virus or bacteria present in your body.
All right, is there anything else?
Yes, a blood test. This test checks to see if you have immunity to the COVID-19 virus by looking for a specific antibody in the bloodstream. Antibodies are small proteins that are part of our immune system.
Okay.
And finally, a chest X-ray is needed if you are tested positive for COVID-19. The X-ray is to identify the spread of infection to the lungs. Am I clear to you?
Yes, it's clear.
All right, after analyzing your symptoms, I would suggest you for a hospitalization.
Hospitalization? No, doctor. Please understand my situation. There is no one else to support my family, and this is a time I need to be there with them.
Yes, I do understand your concern, but staying away from the hospital does not help you.
Doctor, I can stay isolated in my home. Please give away with some antibiotics that can cure my symptoms.
Kindly cooperate with us, Peter. In this situation, the best advice that I can give you is to get hospitalized. Because your breathlessness can only be treated with oxygen administration, and for your persisting symptoms, a set of IV antibiotics is inevitable. Moreover, continuous monitoring of your condition is very essential in this situation.
But I can't leave my family alone.
I acknowledge your present situation. But, staying in the hospital will be a healthy decision for you, as well as your family.
Yes, that's true. I can realize the need for hospital admission and I'm ready for it.
That's great. Now, for you, hospitalization and isolation are very necessary until we get a confirmed test result.
Okay.
The hospital stay is recommended for 14 days as per the COVID-19 protocol.
14 days. It's a pretty long time, but I will manage it in the best interests of me and my family's health.
Good. During the hospital stay, you are supposed to wear an N95 mask. That could protect you from illness and prevent the spread of further illness.
All right.
Along with that, we advise you for frequent hand washing practice to avoid the spread of infection. Is that okay?
Yes, that's fine.
Hope you have understood all of my suggestions.
Oh, yes.
Is there anything I need to be clarified?
No, not really. By the way, may I know how and when I should shift to the hospital?
Yes, I was about to get your permission to call an ambulance for your faster and safer transportation. Is that okay with you?
Is that an ambulance the only option for me in order to reach the hospital?
It is not the only option, but it is the best and safest one.
All right, then you may proceed.
Thank you. By the way, is there anything that I need to be answered for you?
Not really. Thank you.
You are welcome, and once again, I really admire your timely approach and management. Kindly wait here for some time. The ambulance will reach shortly.
All right, thank you. That's the end of your role play. Thank you.
Thank you, sir.
Thank you for watching. Please, like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.